There's a second big lie of type 2 diabetes, and that's the blood sugar control is of paramount importance in controlling the disease. Well, what's wrong with that? Type 2 diabetes causes high blood sugars, and through different mechanisms like oxidative stress or advanced glycation end products, these high blood sugars cause the complications of the disease. That is the eye disease, the heart attacks, the strokes, the nerve damage, the kidney damage. All of that is caused because of the high blood sugar. So, if you think about it like that, then the solution seems fairly obvious. If you reduce the blood sugars, then the complications of diabetes will go away. It sounds pretty good. The problem with it is that it just isn't true. We've known this since 2008. At that point, several large trials were done, and what they did was they randomized two groups of people. One group of people would have their normal treatment. Their blood sugars were just okay, and they stayed on their same doses of medications. The other group, the treatment group, would get treated with lots of medications to really drive that blood sugar down into the normal range. And this is what happened. They were successful in doing this. Over the course of 6 years, you can see on this graph, it compares the two groups. On the vertical axis, you see how their blood sugars did. On the horizontal axis is the time over 6 years. And you can see that that group that took a lot of medications was able to get lower blood sugars. That's great, but that's not really our question. Our question is, did they do any better? In fact, they weren't doing any better at all. They didn't have any less deaths, they didn't have any less heart attacks, they didn't have any less strokes, and they didn't have any less eye disease either. But why doesn't treating blood sugar make a difference? Well, the answer is that we're only treating the symptom of the disease. The root cause is too much insulin resistance. That insulin resistance is what's causing the high blood sugars. But the high blood sugars is the symptom and not the disease. So by treating the high blood sugars, by treating the symptom, we're not actually treating the disease. If you don't treat the disease, then the disease gets worse. I've seen thousands of patients with type 2 diabetes, and the story is always the same. At first, you take one medication, and then after a while, often a year, 2 years perhaps, you take 2 medications. Then you take 3 medications. Then you take a little bit of insulin. Then you take more insulin and more insulin and more insulin. So what's happened over that 10 years, over that 15 years, is that diabetes was not getting better. Because now you're taking more and more medications to do the same thing. We don't want to move the sugar around our body. We need to get rid of it. That's what these medications do, this insulin does. It helps move the sugar from the blood into the body. But if the sugar was toxic in the blood, why isn't it toxic in the body? It is. That's why every part of your body starts to get affected, because there's too much sugar all over the place. You need to actually get rid of the sugar, not move it around. So instead of focusing on treating the symptoms of high blood sugar, we need to focus on treating the insulin resistance. And that's the only way that we're going to get better.